I'm Gina Quattrochi.
And I'm Jeff Smith. Thanks for joining us. Well, high costs and low numbers are behind the decision to close Franciscan Saint Elizabeth Central Campus's emergency room. That'll happen tonight at 10 o'clock. The doors will close for good.
As News 18's Kelly Roberts reports, some wanted to come back for one last day of work inside a facility they see as more than a building.
Dr. Ed Epler does not work at Franciscan Saint Elizabeth's Central Emergency Room. He did at one time, but on Wednesday he was back.
I chose to work here on the last day and shut it down.
Epler started his residency at the Central ER in 1997. He was not the only one who wanted to close down the ER on its last day.
My friends are here, the people who taught me how to practice medicine, the nurses and the staff that I grew up learning how to practice medicine are here right now.
Franciscan Saint Elizabeth Health CEO Terry Wilson says throughout the years people have been choosing to go to the East Campus and numbers at the Central ER have fallen. He says it is also expensive to operate two ERs a few miles apart. After the ER moves out, an urgent care will move in.
And we expect that to happen between now and the end of the month.
For West Lafayette residents, this means the closest ER is now farther away, so we're going to time the drive. In minimal traffic from the 231 corridor, it took 24 minutes to get to Franciscan's East Campus. Obviously, the time would be cut down for those using an ambulance, but Mayor John Dennis says he hopes one day the ride will get even shorter since Franciscan Saint Elizabeth Health plans to develop on 231.
Our hopes is that at some point in time in the future that they would develop an emergency department there, because that's exactly what this community needs.
And that was News 18's Kelly Roberts reporting. Right now, Dr. Epler is working as Associate Medical Director of Emergency Services at Franciscan Saint Elizabeth East. Terry Wilson says there is no need right now to have to lay off anyone because of the closure.